Careers and Jobs in the USA, number 18. Registered Nurses. Learn about careers and jobs in the United States of America and improve your American English with Maestro Sersea. What registered nurses do? Part 1. Registered nurses and RNs provide and coordinate patient care, educate patients and the public about various health conditions, and provide advice and emotional support to patients and their families. Most registered nurses work as part of a team with physicians and other healthcare specialists. Some registered nurses oversee licensed practical nurses, nursing assistants, and home health aides. Registered nurses' duties and titles often depend on where they work and the patients they work with. For example, an oncology nurse works with cancer patients, and a geriatric nurse works with elderly patients. Some registered nurses combine one or more areas of practice. For example, a pediatric oncology nurse works with children and teens who have cancer. What registered nurses do? Part 2. Registered nurses typically do the following: assess patients' conditions, record patients' medical histories and symptoms, observe patients and record the observations, administer patients' medicines and treatments, set up plans for patients' care or contribute information to existing plans, consult and collaborate with doctors and other healthcare professionals, operate and monitor medical equipment, help perform diagnostic tests and analyze the results, teach patients and their families how to manage illnesses or injuries, explain what to do at home after treatment. Registered nurses types. Addiction nurses care for patients who need help to overcome addictions to alcohol, drugs, and other substances. Cardiovascular nurses care for patients who have heart disease or heart conditions and people who have had heart surgery. Critical care nurses work in intensive care units in hospitals, providing care to patients with serious, complex, and acute illnesses and injuries that need close monitoring and treatment. Genetics nurses provide screening, counseling, and treatment for patients with genetic disorders such as cystic fibrosis. Neonatal nurses take care of newborn babies who have health issues. Nephrology nurses care for patients who have kidney-related health issues stemming from diabetes, high blood pressure, substance abuse, or other causes. Public health nurses provide public health by educating people on warning signs and symptoms of disease or managing chronic health conditions. They may also run health screenings, immunization clinics, blood drives, or other community outreach programs. Rehabilitation nurses care for patients who have temporary or permanent disabilities or have chronic illnesses. Some nurses do not work directly with patients, but they must still have an active registered nurse license. For example, they may work as nurse educators, healthcare consultants, or hospital administrators. Clinical nurse specialists, CNSs, are a type of advanced practice registered nurse, APRN. They provide direct patient care in one of many nursing specialties, such as psychiatric mental health or pediatrics. CNSs also provide indirect care by working with other nurses and medical staff to improve the quality of care that patients receive. They often serve in leadership roles and may educate and advise other nursing staff. CNSs also may conduct research and may advocate for certain policies. Registered nurses, work environment and work schedules. Registered nurses held about 3.1 million jobs in 2019. The largest employers of registered nurses were as follows: hospitals, state, local, and private, 60%. Ambulatory healthcare services, 18%. Nursing and residential care facilities, 7%. Government, 5%. Educational services, state, local, and private, 3%. Ambulatory healthcare services includes industries such as physicians' offices, home health care, and outpatient care centers. Nurses who work in home health travel to patients' homes. Public health nurses may travel to community centers, schools, and other sites. Some nurses travel frequently in the United States and throughout the world to help care for patients in places where there are not enough healthcare workers. Injuries and illnesses. Registered nurses may spend a lot of time walking, bending, stretching, and standing. They are vulnerable to back injuries because they often must lift and move patients. The work of registered nurses may put them in close contact with people who have infectious diseases, and they frequently come into contact with potentially harmful and hazardous drugs and other substances. Therefore, registered nurses must follow strict guidelines to guard against diseases and other dangers, such as accidental needle sticks and exposure to radiation or to chemicals used in creating a sterile environment. Work schedules. Nurses who work in hospitals and nursing care facilities usually work in shifts to provide round-the-clock coverage. They may work nights, weekends, and holidays. They may be on call, which means that they are on duty and must be available to work on short notice. Nurses who work in offices, schools, and other places that do not provide 24-hour care are more likely to work regular business hours. Registered nurses, how to become one, Part 1. Registered nurses usually take one of three education paths: a bachelor's degree in nursing, an associate's degree in nursing, or a diploma from an approved nursing program. Registered nurses must be licensed. Education. Nursing education programs usually include courses in anatomy, physiology, microbiology, psychology, and other social and behavioral sciences, as well as in liberal arts. Bachelor of Science in Nursing, BSN degree programs typically take 4 years to complete. Associate's degree in Nursing, ADN, Associate of Science in Nursing, ASN degree, and diploma programs usually take 2 to 3 years to complete. Diploma programs are typically offered by hospitals or medical centers, and there are far fewer diploma programs than there are BSN, ADN, and ASN programs. All programs include supervised clinical experience. Bachelor's degree programs usually include additional education in physical and social sciences, communication, leadership, and critical thinking. A bachelor's or higher degree is often necessary for administrative positions, research, consulting, and teaching. Generally, licensed graduates of any of the three types of education programs, bachelor's, associate's, or diploma, qualify for entry-level positions as a staff nurse. However, employers, particularly those in hospitals, may require a bachelor's degree. Registered nurses with an ADN, ASN, or diploma may go back to school to earn a bachelor's degree through an RN to BSN program. There are also master's degree programs in nursing, combined bachelor's and master's programs, and accelerated programs for those who wish to enter the field of nursing and already hold a bachelor's degree in another field. Some employers offer tuition reimbursement. Clinical nurse specialists, CNSs, must earn a master's degree in nursing and typically already have 1 year or more of work experience as an RN or in a related field. CNSs who conduct research typically need a doctoral degree. Registered nurses, how to become one. Part 2, important qualities. Critical thinking skills. Registered nurses must assess changes in the health status of patients, such as determining when to take corrective action. Communication skills. Registered nurses must be able to communicate effectively with patients in order to understand their concerns and evaluate their health conditions. Nurses need to clearly explain instructions, such as how to take medication. They must work in teams with other health professionals and communicate patients' needs. Compassion. Registered nurses should be caring and empathetic when working with patients. Detail-oriented. Registered nurses must be precise because they must ensure that patients get the correct treatments and medicines at the right time. Emotional stability. Registered nurses need emotional resilience and the ability to cope with human suffering, emergencies, and other stressors. Organizational skills. Nurses often work with multiple patients who have a variety of health needs. The ability to coordinate numerous treatment plans and records is critical to ensure that each patient receives appropriate care. Physical stamina. Nurses should be comfortable performing physical tasks, such as lifting patients. They may be on their feet for most of their shift. Registered nurses. Licenses, certifications, and registrations. Registered nurses must have a nursing license issued by the state in which they work. To become licensed, nurses must graduate from an approved nursing program and pass the National Council Licensure Examination, NCLEX-RN. Other requirements for licensing, such as passing a criminal background check, vary by state. Each state's Board of Nursing provides specific requirements. For more information on the NCLEX-RN and a list of state boards of nursing, visit the National Council of State Boards of Nursing. Nurses may become certified through professional associations in specific areas, such as ambulatory care, gerontology, or pediatrics. Although certification is usually voluntary, it demonstrates adherence to a specific level of competency, and some employers require it. In addition, registered nursing positions may require cardiopulmonary resuscitation, CPR, basic life support, BLS, or advanced cardiac life support, ACLS certification. CNSs must satisfy additional state licensing requirements, such as earning specialty certifications. Contact state boards of nursing for specific requirements. Registered nurses. Pay. The median annual wage for registered nurses was $75,330 in May 2020. The median wage is the wage at which half the workers in an occupation earned more than that amount and half earned less. The lowest 10% earned less than $53,410, and the highest 10% earned more than $116,230. In May 2020, the median annual wages for registered nurses in the top industries in which they worked were as follows. Government, $84,490. Hospitals, state, local, and private, $76,840. Ambulatory healthcare services, $72,340. Nursing and residential care facilities, $68,450. Educational services, state, local, and private, $64,630. Nurses who work in hospitals and nursing care facilities usually work in shifts to provide round-the-clock coverage. They may work nights, weekends, and holidays. They may be on call, which means that they are on duty and must be available to work on short notice. Nurses who work in offices, schools, and other places that do not provide 24-hour care are more likely to have regular business hours. Registered nurses, job outlook. Employment of registered nurses is projected to grow 7% from 2019 to 2029, faster than the average for all occupations. Growth will occur for a number of reasons. Demand for healthcare services will increase because of the aging population, given that older people typically have more medical problems than younger people. Nurses also will be needed to educate and care for patients with chronic conditions, such as arthritis, dementia, diabetes, and obesity. The financial pressure on hospitals to discharge patients as soon as possible may result in more people being admitted to long-term care facilities and outpatient care centers, and in greater need for health care at home. Job growth is expected in facilities that provide long-term rehabilitation for stroke and head injury patients, and in facilities that treat people with Alzheimer's disease. In addition, because many older people prefer to be treated at home or in residential care facilities, registered nurses will be in demand in those settings. Growth is also expected to be faster than average in outpatient care centers where patients do not stay overnight, such as those that provide same-day chemotherapy, rehabilitation, and surgery. In addition, a large number of procedures, including sophisticated procedures previously done only in hospitals, are now done in ambulatory care settings and physicians' offices. Job prospects. About 175,900 openings for registered nurses are projected each year on average over the decade. Many of those openings are expected to result from the need to replace workers who transfer to different occupations or exit the labor force, such as to retire. Overall, job opportunities for registered nurses are expected to be good. However, there may be competition for jobs in some areas of the country. Generally, registered nurses who have a Bachelor's of Science degree in nursing, BSN, will have better job prospects than those without one. Employers also may prefer candidates who have some related work experience or certification in a specialty area, such as gerontology. Registered nurses summary. 2020 median pay, $75,330 per year, or $36.22 per hour. Typical entry-level education, bachelor's degree. Number of jobs 2019, 3,096,700. Job outlook 2019-2029, 7%, faster than average. Employment change 2019-2029, 221,900. Citation: Bureau of Labor Statistics, U.S. Department of Labor, Occupational Outlook Handbook, Registered Nurses.